Overcrowding relates to hospital patients doctors have decided should be admitted but for whom there's no bed free. On the 8th of March 2006, there were 495 patients on trolleys. Then Health Minister Mary Harney described overcrowding as a national emergency. A new record of 569 patients on trolleys was set on the 5th of January 2011. The newly appointed Health Minister, Dr James Riley, said that level of overcrowding would never be seen again. On the 6th of January 2015, there were 601 patients on trolleys. Leo Varadkar, then Health Minister, said he was sick to death of the problem. Another record was set with 612 patients on trolleys on the 3rd of January 2017. Simon Harris, as the Health Minister, said influenza was a big factor. The highest level of overcrowding ever recorded was on the 3rd of January 2023, when 931 patients were on trolleys. And last month, on the 6th of January, there were 761 patients on trolleys. The hospital with the most persistent level of overcrowding has been University Hospital Limerick. It often reports over 100 patients waiting. Cork University Hospital and University Hospital Galway also see high levels of overcrowding. These figures are from the Irish Nurses and Midwives Organisation trolley system, which the union has been operating for over 20 years. A range of factors have contributed to overcrowding. Doctors say there's a lack of beds. We have seasonal factors like influenza and a growing and ageing population. To help ease pressures, the HSE has added over 1,200 new acute beds since 2020. And there's now more senior decision-making at weekends by consultants to discharge patients and free up beds. But the problem persists, and today there were 641 patients on trolleys.
The emergency department at University Hospital Galway, where 50 people were waiting on trolleys this morning, with a further 29 patients in a similar situation on wards around the facility. The experience here is mirrored up and down the country. Figures from the Irish Nurses and Midwives Organisation show 641 people were on trolleys nationwide today. And as those daily tallies remain stubbornly high, there's a persistent sense of anger and upset among the public.
My husband was in hospital on the trolley and for about 3 or 4 days, but what can you do? It's really overcrowded and it's disgusting.
It's very frustrating, yeah. And we've had lots of family coming in to see her, and it's like a rabbit warren, people keep saying, and there are trolleys on corridors trying to find your way around.
Those at the front line of the public healthcare system say the ongoing overcrowding continues to impact on patient outcomes.
There are multiple international studies that demonstrate how dangerous overcrowding is. A study that was published in the Emergency Medicine Journal in 2022 demonstrated that there was an excess death for every 72 patients who waited 8 to 12 hours.
The HSE said today there'd been a significant increase in the number of people aged 75 and over with complex care needs attending emergency departments since the start of the year. The executive says there's been a massive effort to optimise capacity and deal with pressure across the hospital system all winter, but the problems persist.
And those nationwide difficulties are neatly encapsulated by the situation here in Galway today. As well as a crowded emergency department, patients face long wait times for beds as others have elective surgeries cancelled. On top of that, hospital management have imposed visitor restrictions as they battle to contain the spread of a virus on a number of wards. Pat McGrath, RTE News, Galway.